Hi, everybody. It's time for Carpools and Cannulas. It's been a minute since we've been able to get together. I'm just going to keep checking my texts. So I'm excited for Dr. Greer to join us for our first Carpools and Cannulas. She's requesting some 22. So I think she should be on in a second. I feel like my connection has not sped up this year.
Hi.
Hi, how's it going?
Good. It's very dark in Cleveland at 8:30.
Oh yeah, I bet. It's getting dark right now, in San
Oh yeah.
Diego. But hey, Erin. So I love the new do. You chopped it off?
Thank you. I did. It was absurdly long. Oh, thanks, babe. Yeah, lights are good. Thank you. My husband was like, "Why are you sitting in the dark?" Yeah, I chopped it. I donated it.
Oh, cool.
So
I've done that
yeah,
before. So like
yeah,
you need 10 inches is usually the requirement, right?
yeah. I was able to do 11,
Oh,
so
nice.
it's
Yeah.
short.
I know. Maybe I should work towards that.
It was nice. I mean, it's nice to actually wear it down. It was always in a bun,
Mm-hmm.
and it was
Yeah.
heavy.
I usually
Yeah,
like every several for I don't know, I go through cycles where I like chop it all off and then grow it out. Chop it all off and grow it out. Oh, my sister
yep.
says it looks cute.
Thank
She's a
you.
Asian hair.
Nice.
Cool. And back in action after like the most bananas December
Oh
was
my gosh.
so busy. Yeah.
Yeah. It's been just crazy here too. And I mean, we're in the midst of a COVID surge.
Yeah.
So
Are your ORs open or just at the
they
hospital?
are not, but I'm at an ambulatory surgery center. So I
Mm-hmm.
am still up and running. But Cleveland Clinic and University Hospitals, our two major hospital systems, haven't had any elective surgery going, I want to say, since December 22nd.
Oh, wow. Yeah.
Yeah.
I know. I saw you post about it, so it's kind of a big deal. There are
Yeah.
elective
It's been a
surgeries in
while.
San Diego, but I think we have a higher proportion of vaccinated people, maybe, which
Yeah.
helps a little bit. And then, so really the issue isn't that the hospital is full, it ends up becoming a staffing problem. Like we don't have nurses and doctors to run things because they're sick, positive with COVID. So,
Oh, yeah. One of the major hospital systems just south of us is no longer having staff stay home, even if they're COVID positive. If they can work, even if they're symptomatic, come to work. That's
yeah.
how bad it is. The National
Oh,
Guard has been deployed to all of our hospital systems. It's bad.
yeah, I saw that. I saw that you posted that. That's crazy.
Yeah.
Yeah, we're not quite that awful yet. So hopefully we don't. I think we'll skirt the top of the trees on this one. But yes,
Hopefully.
our
Yeah.
ambulatory surgery center is the in-office ORs are open for surgery. And I've had one cancellation, so rescheduled due to COVID positive, asymptomatic positive, and then a handful of clinic patients that have called and said, I got exposed or I'm sick or something like that. Um, so we're just, that's great. If you're sick, please don't come in the office for
Yeah.
your Botox or your
Yeah.
appointment. So we appreciate that.
Oh, I see one of my patients on there worried her surgery will be canceled. You're going to be okay unless it's literally to the point where they're pulling the anesthesiologist out of the ambulatory surgery center or stealing the ventilators. It should be fine.
Right. Which was
And
like, I don't
yeah,
think we're going to get
I don't
there.
think, well, it seems to have leveled. Our case numbers have been steady. So hopefully the decline will be quick too. But the surgery center is still running strong. Yeah, like they have to look a little hard to find gloves. I've been having trouble finding saline for my Botox dilution. Have you had the same issue?
Oh, no. I
No?
should just mail you some. The
Oh,
most
that'd be.
random things are, I could
Oh, yeah.
probably send you some.
I'm using like the little IV bags now because we
Oh,
can't
no,
get
we have the
vials.
little,
Vials,
seriously,
yeah,
we
the
can
bacteria
talk,
static.
just text me later and I can send you some.
Amazing. Yeah.
Yeah, and I'll double check that but we have to buy like a pallet of it,
Right.
at a
That's
time.
what I
So
normally do. And then now it's
it's,
out.
yeah,
Yeah. Or
it's
just
weird
bring some to Tucson next month.
oh
Load them in
yeah,
a
we could do
suitcase.
that.
Yeah.
I did that
Yeah.
when, like the last time we were in person, I bummed sculpture off of somebody.
Yeah. That'll work.
So, we can do that as well. So, okay, so COVID surge for 2022. Do we have any other predictions? Maybe
Oh,
more positive?
I want to make earlobe filler the next hot trend. I want to do that. No, I'm not even joking. I filled my earlobes yesterday,
Uh-huh.
Monday, because my earrings were droopy. Do you ever have that problem?
Yeah.
Your earrings are like,
The really heavy ones.
no, no, like these,
Just
like my
generally.
cubic zirconia studs. Yeah, they were like pointing straight down, and so I just put a little RHA, like point 2, 0.3 cc's in each earlobe. It was great.
Oh, no bruising, and mine only
I mean,
droop if
not
they're
really.
heavy. Does it offer
Yeah,
any like support?
support. It does, because it was just like, earlobes thin out with everything else as you age. If you guys have never looked, like when you hug your mom or your grandma, depending on how
Yeah.
old you are, check out her earlobes. Like they're thin, they're longer, and mine were thinning out. So I plumped them up a little bit, and shabam, my earrings are back at the vector they should be at. And the weird thing is, like, I hardly felt it. You couldn't really feel the needle going in, which was nice.
Yeah, in terms of areas to inject, it's pretty
Painless.
straightforward. So maybe
Yeah.
it's all about the ear. We should do that. The next one, we can talk about ears because I do you do otoplasty? Sure.
I don't. I
Hmm.
literally scrubbed not a single one in residency.
Mm-hmm.
But I want to make the earlobe tuck another big thing.
Well, we
Earlobes
could
get
talk about
big.
earlobes and the ear. I do otoplasty. I do it under local now, which I didn't
Okay,
do before, but it's really well tolerated, and then people are like can see
nice.
what they're getting,
Yeah,
and then everybody's on the same plane. So
that's
we
nice.
can yeah, we should talk about that because yeah, in California we tend to have more people with the plugs, the bigger ear
Oh,
things
yeah.
that stretch
Yeah.
out, and then when you decide you don't want to do that anymore, it's
You repair them. Yeah, I've repaired
yeah,
several of those. I do a lot of torn earlobe repairs too.
cool. All right, well
Yeah.
we won't talk about it too much. What other
Okay.
trends then?
I've had a ton of facelift consults lately.
I feel
Like
like
people
things
are just,
zoomed out,
yes. Yes, it's like everybody's seeing themselves on camera and they're like, I'm ready.
ready
I'm
to do
doing it.
something.
Mm-hmm.
So that came up today. I've been talking to Dr. Marissa Lawrence, and then
Mm-hmm.
one of my patients who had it done elsewhere a few years ago when I did breast surgery, and she was interested in doing just a little tiny mini facelift, which I could use that. But
Yep. Can't we all?
so just a little under local, and then like Marissa calls it the Band-Aid facelift under local,
Mm-hmm.
and you're just taking a little skin and maybe putting a couple of smash sutures right there. So I'm thinking about starting to offer that because I do get a lot of people that don't really need the full deal and want just a little tweak. So we'll
Yep.
see if
Yeah, I
those.
do those sometimes. I mean, I love just doing the full deep plane and then you're like good for the next 20 years. And
Right,
I've
right,
had a lot of patients lately who are just showing some signs of aging and they're like, I just want to prevent it. Let's do it.
right. And they'll do the deep plane.
Yeah, yeah.
Oh, wow. Okay.
Got a couple scheduled, which is nice. I personally want a brow lift coming up.
Yeah,
Maybe we
Erin's,
could do that at WPS. Erin
yeah.
volunteered for the short scar facelift or
Yeah,
the
she'll
mini
like
facelift.
elbow you out of the way for the brow lift. I just need to
Go.
schedule some time and do hers. Be easy under.
What technique? Oh, we haven't. Have we talked about brow lifts? I don't
No.
remember. That's a good one because I just changed techniques this past year.
Yeah, we can definitely. That's another one. I should be writing this down.
I know. Lincoln, take notes. My Schindle's not taking notes. He's just sitting here. He's like,
So we're going to talk about ears and brows.
yeah.
Okay, cool. Yeah, the lateral brow lift. It's a maneuver. Because if I see one more dumb thread lift thing where that doesn't work, I'm going to lose my mind.
I know. People love those. I saw a facelift patient or a consult for a facelift patient 2 weeks ago and she'd had threads and she just had all these little lumps everywhere.
Mm-hmm.
It's
I
not
think it's
awesome.
good for like a minute and for Instagram. It also reminds me of the plasma pen. Another thing to be noted and then dismiss that looks good on Instagram for a minute, but long term you're like, what's happening?
And then in 10 years when everybody forgets about it, they bring it back.
Right. That's totally what happens.
Because like thread lifts keep coming back and everybody's like, but they still suck.
I know. At least they've made some improvements. And remember the original ones were like proline sutures and blue, and people just looked like they had strings in their face. And I do know a couple of people had gotten lasered and then had the melt or something. I don't know.
Oh, God.
At least the the complication rate is low, I think, with them now. It's just that they don't last and aren't really that effective. But at least
Probably
you're
why
not.
the complication rate's low. You're not getting like weird tugs and pulls, and they dissolve. So
Yeah.
yeah,
Yes,
not something
exactly.
I'd want to have to dig out. Yeah.
Yes, they did melt because it was proline, Aaron. This is really awesome. People ended up with like blue under their skin.
That's great.
Yeah, good times.
Yeah.
BMI limit for breast reduction. I thought I did, but I recently did one. I think it depends on the person. Sometimes insurance has a cutoff. I would say 35 or less for a BMI cutoff is goals. But then it depends on the patient. I did one for somebody who was at a 42. But if you're super tall and most of your weight is in your breasts, then sometimes that's what you need. What about you?
Yeah.
Do you have
my
a cutoff?
When I was in insurance in network, I would do up to 40. Although I found like I broke that rule once or twice, and it's kind of interesting because if you go too small, then they look kind of disproportionate and flat chested. And when you have really large breasts, which is common if the BMI is higher, then often you need to do a free nipple technique, but the shape there isn't nearly as nice. So it's like the end result's not as nice, and there's a higher risk of healing problems. So 40 is about my soft cutoff, but now that I'm out of insurance, I tend to not get patients quite that size.
Right. Yeah.
For whatever reason.
It's not common here. I feel like I more commonly have not so much people with BMI cutoffs, but they want either more taken off than maybe the aesthetic normal is, or whatever you want to, wherever you want to set that bar, because there's a lot of gender fluidity. So they don't want to be completely flat, but they want to be as small as possible.
Yeah.
And then I have some people who don't want to be too small. And so insurance, Kaiser's a big system here, will say, you know, I have to take this 400 grams off is the usual insurance cutoff. And so, and doing that's going to make you really small. And so then they're like, okay, I don't want that. I just want them a little smaller, but I really want them lifted. So yeah, that's kind of my sense. I feel like anytime there's a hard stop or a hard number on surgery, you end up having exceptions, and that's
always. Well, and I've never had a cutoff for tummy tuck, which is why I'm talking about high BMI next month. And it's interesting because looking at the data, I like a third of my tummy tuck patients have a BMI over 30. So I do a lot of them.
Yeah, I think it's also just the patient as an like, as we all know, that you can be a healthy BMI of 30 or you can be an unhealthy BMI of 30. There's a lot of other things that play into it.
Yeah.
So.
I think another surgery I'm going to be doing a lot of this year is breast lift with Galaflex.
Oh, okay.
Yeah, I use a lot of it. And I've just had so many patients who want that upper pole fullness, but they don't want an implant, and Galaflex is nice for that. I need to find somebody who loves it as much as I do to do my lift with Galaflex. I think this might be the
where
year.
Are you changing your technique? Are you doing like a central mount?
No, I still do superior medial pedicle, and I either wedge resect the lower pole or tuck it up under, like massive weight loss patients. And then I just elevate skin flaps at the level of the breast capsule. So you're suspending all the breast tissue with a little sling of Galaflex, and it's tacked to the rib periosteum or perichondrium on each side. And it just, man, it gives a little oomph. I love it.
So you're just putting it kind of under the breast skin flap.
Exactly. Yep.
Yeah, I do like Galaflex. It's been, I do a fair amount of breast implant revision surgery, and it's very helpful for setting where that implant needs to go when you have to reset where it is. That's interesting. Yeah, so we should talk about Galaflex. So yeah, I'm excited to hear your talk at WPS in Tucson. So we're all meeting there February Super Bowl weekend, the 3rd through the 6th.
Oh, is it?
Yeah, someone always points that out. I'm like, it's female plastic surgeons. I mean, 99% of us could care less.
Yeah, it's true.
Yo, yeah, let me reschedule my trip to Vegas where I was going to place bets. Okay.
It's okay. Sports betting's legal here in Ohio now. I can do it from home.
Oh, you can do it from your home. Yes. Yep. Okay. So Yeah, so we'll be talking about a lot of things. Somebody's asking where we are. I'm in San Diego.
And I'm in Cleveland. So we're
Cleveland.
like covering all the time zones.
That's right. So yeah, so then okay, so let's talk. We'll try to stay on track because we have some topics. So other
really good at
surgeries
that
we're
too.
looking forward to doing. I'm actually doing more and more. Speaking of breast surgery that doesn't involve an implant, is breast enhancement with fat transfer.
Yeah.
And so I do really feel like that is so nice for somebody who wants a little more volume, a little bit more upper pole, and doesn't want the hassle of an implant or long-term commitment to an implant or isn't ready for whatever reason.
What fat transfer system or fat processing system do you use? Because I know Revolve has been in back order for ages.
Oh, right. Yeah. So I used Revolve when I was at the Navy facility because we had it. And then I've used a bunch of other systems depending on the institution I'm operating at. But I really like Micro Air is one option, and it has a nice closed system. I think that's the one I prefer. So the canister itself, so when you do fat transfer, for all our audience, you're liposuctioning the fat from one place, and then you have to get that fat separated from the fluid and the little bit of blood that's in there, and then put it in something to inject it with, either a cannula attached to a syringe or a cannula attached to like the Micro Air system. And there's pros and cons of doing it that way. It just depends. But even when I was at Kaiser working there part-time, they switched to the Micro Air system, which is a closed system. But originally we would hand harvest fat and then hand inject it, which works. It just takes forever. And they centrifuge the fat, which I don't think most people do anymore. So
that's still how I do it for faces. I don't do a lot of high volume to the breast, but I want to find a better system, and we have a Micro Air. So
so it just goes in, so the tubing plugs right into the sterile canister, and the canister has a special part at the bottom that lets you, so when you let the fat sit, I'm not explaining this to you, but to followers, the fat rises to the top and the other fluid comes at the bottom in this canister, and then you can just decant it. So you just let it like bleed off basically. And then you just have the fat, and you're not messing with it. And then you can hook up the same tubing and reverse the flow, and you can inject under power with that if you're doing a large area. So for like a Brazilian butt lift, or if I'm doing large volume, like, a few hundred cc's to the breast. If I'm just doing a touch up or a little bit, then I prefer to hand inject it because you're not like, oh, that was just 100 cc's that went in. Depends on how much you're working with. But it is really nice, and I think it works. What I'm trying to look at critically is how much of that fat is preserved and sticks around.
Yes. Yeah. And it's hard to find enough fat on a lot of thinner women.
Yes. So yeah, sometimes I scrounge. I have my little go-to areas where you can usually find fat. But Sarah Mess, another plastic surgeon that is going to be speaking at our conference in Tucson, does a lot of fat transfer as well. And I have heard her speak before on it, and she has a similar technique. She does a couple other funny maneuvers that she thinks also helps the take of fat. So the sad thing is when you see people do this, the less you manipulate the fat, probably the better, up to a point. But you don't want to inject everything that you suck off, because then you're injecting things that aren't fat and aren't necessary, and make it look bigger, and then that all gets absorbed. So finding that happy medium where you
see the immediate on the table results of look how
again on Instagram, you're like, oh, that's amazing, and then 3 months later it's all gone.
Now, who was the guy with Bravo? Was that Roger Corey, and he had like a suction bra? Did he just get like indicted for Medicare fraud or something crazy?
He might have. Yes. Yeah. I mean, he did do a lot of fat grafting. He kind of paved the way. Yes.
Yeah, he did. I don't know if the negative suction thing ever really caught.
It didn't ever catch on because it was really, but I do feel like cupping has its advantages. I don't know if I would do that prior to fat transfer, but cupping in general can really help the patient, but not a giant bra that looks like, or thing. It was these huge suction cups that went on your breast, and you were supposed to wear around the clock to
Yeah. It'd be like wearing a breast pump on steroids. Yeah, no thanks.
It was very Austin Powers looking like, and it didn't catch on.
Shocking.
Shocking, right? Created by man. Oh, you can see that I have somebody who's trying to make their way to the couch in my bedroom in the evening.
Nice.
That then she moves closer to her own room.
There's like a whole bed.
Yeah, it's a pull-out couch.
That's nice. Maybe we should get one in our room. We gave up long ago.
I know. Well, it's on her, you know, she's now motivated. So there you go.
Nice. All right, so fat transfer the breast, matched with breast lifts, facelifts, brow lifts,
earlobes.
Yeah, earlobe. Anything earlobe. The earlobe tuck, the filler. Look how perky these earrings are, guys. I'll have some before and afters on my Instagram feed next week. They actually look pretty dramatic.
Oh, yeah. I will have to take a peek at that. Maybe I'll have you do my earlobes.
Happy to. I have a product.
So I think any other, I don't know if there's going to be like a new trend for filler or a new technology. The one thing I did see that was really cool, which we'll see if it pans out, was the Ellicore device. Have you heard about this? Where it looks like a sewing machine that goes to your face and it takes out little cores of skin.
I heard about it. Yeah,
I saw it demoed.
But they're like deeper cores and more tissue than you would get with like a fractionated laser, right?
Oh yeah, no, it's like taking multiple mini skin biopsies of your face,
like aerating a lawn.
Yes. It's pretty dramatic.
That sounds intense.
It is. So we'll see. I watched somebody demo the machine, and then oh my goodness. My kids are hijacking my. There. Can you hear me?
Yeah.
Okay.
I can hear you. You haven't cut out.
Okay. I see my kids' AirPods connecting to my phone, so it's really annoying.
Oh, yeah.
So anyway, yeah, so it does like remove supposedly like 1 inch to 2 inches of skin. We'll see, depending on the density that it takes out. But I'm waiting to see how those patients are recovering. They're not mine, so I'm just kind of on the sidelines watching. It's interesting. Again, back to the like minimally invasive. It's not non-invasive, but a minimally invasive like face tightening thing, which is what we're always looking for. Someone's asking if we're doing elective surgeries. We are. ORs that are not affiliated with a hospital, like an ambulatory surgery center, is doing elective surgery. Just the patients are, negative COVID tests prior to having surgery, because we're not really attached to the bigger medical systems. And in San Diego, they're still doing elective surgery, period, but not so much in Ohio.
Not in Ohio. We have one small hospital that I have privileges at that's doing elective surgery, but they're basically bumping everybody who's not ortho. Just doing like really urgent stuff. I actually had a big posterior body lift on there next Tuesday, and the patient didn't ever get a call for her pre-admission testing visit. We called, we're like, what's going on? Oh, yeah, we're not going to be able to accommodate that case. Cool.
Right. Thanks for letting me know.
Yeah.
That happened to me a couple months ago with a case at the hospital facility, and I was only operating there because I was doing a combined case with somebody else who operated out of there, and it was just easier for him.
Yeah.
And it was the same thing. They're like, we don't have staffing. We're canceling this case. I'm like, I would say that I can't stand that. Yeah, Aaron's like, been there, done that. Can't stand that if it's a pain patient, but honestly, I can't stand it, period. If I have an insurance patient, you're doing a breast reduction, you're usually youngish, maybe you have kids, you have somebody coming into town to help you, like, you can't be planning this, and then a week before surgery, the OR is like, no, yeah, sorry. And no like solution presented.
No, the same OR did this to me early December, just saying we have too many staff out with COVID. They called me the day before, and I had 2 patients on the next day. One of them had friends flying in from out of town. My surgery center, I love them. They got both those patients on that week.
Right, and I had to do the same thing. I had to move. I had to move the other patient who got the combined case, and we were able to find somewhere else to do it. But yeah, it's very frustrating for everybody. But yes, I totally understand from the patient's perspective. You're trying to like plan your life. And
I had my daughter's open heart surgery was bumped back a week the day before. So I I know that. It's
Yeah, right?
Yeah. The surgeon threw out his back. That's what happened. And it was like, well, I mean, what are you going to do? But then I didn't want to reschedule my surgery patients, which is how I ended up doing a breast reduction the morning after her open heart surgery after sleeping in the PICU all night. It was fine. But yeah, it's horrible. I've been there. So
Yeah. Yes. Yeah. Definitely been on that end.
an age that is too old for breast reduction. Erin, great question. It's going to be the age at which you regret that you didn't do it 20 years ago, literally. But no, I've done breast reductions in 70-year-olds, mid-70s.
Mm-hmm.
If you're healthy.
Definitely in the 60s. Yeah.
Yeah, if you're healthy, it's not an issue. And it's not a hard surgery to recover from. But, like, do it sooner because then you get to enjoy more years with smaller breasts.
The most common complaint for women that have it over 50 is that they should have done it 20 years earlier.
Yep.
So, yeah. Okay, so I think we've talked about pretty much, I think we have a nice list of topics that I actually wrote down because I won't remember.
Okay.
And then
you're taking notes this meeting. I did not.
And then we will maybe reconvene in 2 weeks, although I don't know what date that is. Should do something.
Yeah, that should be good. We have an attempted trip to Orlando next week. We were supposed to go in October and I got COVID. So this is the reschedule. I'm kind of waiting with bated breath to see if we actually get on the plane without anybody getting COVID. And if we don't get kicked off the plane because my 2-year-old is just not like developmentally capable of wearing a mask. So we'll see.
Oh, are you guys going to go to Disney? Is that the plan?
Yes. Yeah.
That'll be fun.
Cool.
My mom's currently in Florida. Actually, if you go, we should chat. She just went back there to do something and she's going to be running around Orlando probably at the same time.
Fun.
Yeah. So, but not next Wednesday, the following Wednesday. So I'll just text you. Maybe we can sort out what we're going to talk about.
Sounds good. And it'll be my turn to host. So you guys can all look on my feed. And then, of course, we always post it later, too.
Yes. All right. Well, Happy New Year, everybody. And thanks for watching and asking great questions.
Yep. And you can always DM us if there are special topics you want to hear about.
Yep. All right. Thanks. Bye, everybody.
Bye.